Welcome to my presentation of end-of-life journey with hospice. Today, I would like to discuss symptoms related to certain diagnoses of terminally ill patients. With most end-stage terminal cancer patients, the symptoms are relative to the organs affected by the metastasis of the cancer. For example, with stomach, intestines, pancreas, gallbladder, liver, symptoms are usually digestive complications such as nausea and vomiting, decrease in appetite, pain, jaundice observed in the eyes and skin with increased blood bilirubin levels, diarrhea, dehydration, ascites, anemia, fatigue, low blood albumin levels causing generalized body edema. Also, edema of bilateral lower and upper extremities are observed. With lung metastasis or end-stage lung diseases such as COPD, respiratory distress, severe shortness of breath, pulmonary edema, and edema in the legs, cough, hypoxia, low oxygen levels, fatigue, may or may not have pain, with heart failure or congestive heart failure, chest pain, atrial fibrillation, tachycardia, bradycardia, myocardial infarct or heart attack, respiratory distress with cardiopulmonary symptoms, severe shortness of breath, edema in the legs, cough, hypoxia, fatigue. Lymph nodes with metastasis of the lymph nodes, swelling of lymph nodes, lumps, pain, nausea and vomiting, decrease in appetite, weight loss, fever, diaphoresis, anemia, generalized edema, fatigue, skin irritations, and itching are observed. With brain metastases, depending on the location of part of the brain, being pressured will affect the area of neuromuscular function, being controlled by the area of the brain. Some of the symptoms are headaches, migraines sometimes, vision changes, memory changes, and changes in muscle controls and motor functions. One of the patient's diagnosis of the brain cells deterioration, also most commonly qualifying for hospice care diagnosis, is end-stage Alzheimer's or dementia patients. It could be an early or a late onset in patient's life. The symptoms with end-stage Alzheimer patients usually are the same with short memory loss, initially starting with occasional episodes of short memory loss. Then gradually and progressively, patients become confused, withdrawn from social circles, becoming depressed as they are gradually left alone, away from social circles, without any activities and mental stimulation. Patients become more and more immobilized and gradually become wheelchair bound. Patient also has decreasing appetite and by eating less and less until the brain cells deteriorate, causing muscle and motor functions to decrease, resulting in dysphagia, difficulty in swallowing food, and progressively will also cause difficulty in swallowing fluids, resorting to the use of thickener to facilitate patient to be able to take fluids and prevent aspirations. With the decreasing fluid and foods intakes, patients manifest signs of having dehydration, loss of muscle weight, and also start getting weak and deteriorate in their muscle control with decreasing mobilization. Again, gradually, patient becomes bedridden. Most cases, patients are started on G-tube feedings. Being mostly neglected, patients become more and more emancipated and mentally shut down, with a flat effect on their face, not showing any recognition to their family and close relations. Patients become secluded in their little world, losing their mind and muscle control of the body, to even losing control of their bowels and bladder. Most family members I have been involved with taking care of these patients, wanting to keep their loved ones close by, have very seldom done what the patient needed for the good and benefit of these patients. Unfortunately, whether patients are sent to nursing homes or kept at home, these patients are mostly neglected in their care, not only physically, but also mentally and spiritually. Practicing preventive medicine all my life, advocating patients' rights as human beings, I strongly believe that Alzheimer's progress and prognosis could be slowed down and in some cases prevented as many years as we can help to do so. Even though causes of Alzheimer's is mostly considered as unknown, it is believed that it could be related to lack of or decrease in certain food intakes as phosphatidylserine, bacopa, ginkgo biloba. It is also believed to be due to a bacteria caused by Porphyromonas gingivalis of the gums, which is a gram-negative anaerobic pathogenic bacterium known as Phylum bacteroidetes. From early stages of Alzheimer's, when diagnosis is confirmed, the use of medications such as Aricept, other brain-supporting supplements such as ginkgo biloba, bacopa, acetyl L-carnitine, and foods supportive of brain cells should be provided, as well as mental stimulation by activities and encourage social circle exposures, reading books as to increase interest and patience with patients' memory loss, providing positive reinforcements and incentives. As it progresses, use past memories to make them as your conversational subject to entice patients to feel important, needed, and loved, and keep them with their happy thoughts and memories. There are two different personalities with Alzheimer's dementia patients: the aggressive, vocal, combative, stemming out of mistrust and insecurity, and the other, the quiet, more calm, content, smiling, and submissive personality. These two different personalities stem out of their past interactions in the family environment, relationships, and with the patients in their earlier life experiences. Patients who have lived in a trusting, loving relationships among family members and were content with their lives seem to have the serenity and the positive outlook with life, and their reaction to their illness with the love and trust they always lived with. On the other hand, if the patient had a very disturbing relationship based on mistrust, negative attitudes, and hatred toward family members during their lifetime, they seem to always have a very mistrust, hatred, and aggression showing in their behaviors in their end-of-life experience. This situation makes it very difficult for the patient to be loved and cared for, and are avoided more and more, making them neglected by their families, and also making the patient feel increasingly aggressive with lack of trust towards their family members relating to the memories of the past life experiences. because their past is very real for them. The present has no meaning to these patients. For them, the past becomes a reality that they cling to. The more advanced the symptoms, the more aphasic the patients become without speech. They still understand when we speak to them, as evidenced with their scolding gaze at times, looking at us almost as if talking to us with their emotions in their eyes. It is very unfortunate for these patients to be forsaken in nursing homes or boarding cares, declining, deteriorating physically, mentally, and spiritually with complete neglect, without any close family contacts to nurture them with loving care and comfort. Nor would they be able to stimulate their minds with their memories. Oftentimes, I have also witnessed patients being completely neglected physically, developing body sores, and their skin becoming necrotic. Slowly, even in their own home environment, they're neglected by their own families. In most instances, they are used as money-providing bodies to the family members, keeping them, unfortunately. Please stop being selfish in taking care of your loved ones. Think about the patient as a human being and stop selling the souls of these human beings as your loved ones. If we could only realize that these loved ones could be us as human beings. Individual human beings and souls like us. What would we want to have? How would we want to be treated? Where and how would we choose to live? God and universal powers do exist. They are real. How will you choose to live with your own conscience? Please think about this. It is a very sensitive issue when we're dealing with our own parents, grandparents, going through these Alzheimer's symptoms. And some of them, they don't know where they're heading, but we can make it a better life for them. Please do not hesitate to call me at 818-634-0656 for any questions you may have with my philosophy of hospice care. God bless you all. Stay safe and healthy until we meet again.